Welcome everyone. So thank you for signing the informed consent and the questionnaire with some basic information about yourself. We also really want to thank you for spending your time to participate to this focus group discussion. Your comments are very important to us. We would first start to introduce ourselves. So as you noticed, we are two today. One observer, she will take notes. She will not talk, but she will take notes about things that we cannot record. Could you please present yourself shortly?
Hi, my name is Jan.
Yes, so I am Valerie. I'm from the Netherlands. We are both researchers from Heidelberg University. We are doing this focus group discussion to assess the challenges of breast cancer screening in your country. As you all come from different countries, we would like to know your opinion. We do not expect you to know everything or there are no wrong or right answers. We also understand if you don't have the full picture, so don't be afraid to give wrong answers. This session will take around 30 minutes. It is recorded, but your name will not be linked to the given information in our final report. The recordings will be kept under key until they are being transcribed, and they will be destroyed afterwards. You also signed for that, so I think I'm repeating now the information. I would like to discuss some ground rules. As I said, there are no right or wrong answers. We are allowed to disagree, but we don't criticize each other. Please do not discuss the comments of your colleagues outside of this session. We will not speak in a particular order. Everyone can just talk when they feel like, but we have to wait till until the other person has finished talking. I think that are the most important points. Do you have questions so far? No? Do you have something to add?
No.
No? Okay. Let's begin then, if everyone is ready.
Yeah.
Okay. So I would like to start with everyone introducing themselves. You give your name, the country where you're from, and say just if you are aware of if there's a breast cancer screening in your country, and what are the main challenges in like one sentence. You can start.
I'm Mary Kamel. I am family physician from Egypt. Breast cancer is increasing nowadays in Egypt, and we all notice this problem. I work in primary healthcare centers in Egypt, and we have many screening programs for breast cancer.
Okay, thank you.
My name is Jonas. I represent Eritrea. I'm a global health expert. On the topic that we're talking today, the breast cancer screening, even though the problem is increasing and the incidence is increasing, our country is yet to implement the screening programs, but still some screening programs are being done in the gynecology ward center.
My name is Sohailo. I'm from Tajikistan. I'm a global health specialist. And breast cancer has the highest prevalence among other type of cancers in Tajikistan, so definitely it needs attention from the high authorities. And the problem is with the screening, of course, like in the past we had very few screening in the past, but now it's improving. Now it's in process. Like we have the healthcare providers, they conduct a campaign and they teach other women about self-breast examinations, and also we have now new technologies like mammography present in our health facilities and in other hospitals, so it's getting improved.
Yeah. Thank you very much. We would like to hear more about that in the discussion.
Yeah, I'm Claudia Don from Sri Lanka. So I'm a medical doctor and as well as a global health specialist. So I have some experience in consultation. I mean, it's like advisors for breast cancer women who had got breast cancer. So, and I've worked in the primary healthcare setting as well, where especially the screening is carried out.
Okay, thank you.
My name is Temescan, and I'm from Eritrea, and I'm a global health expert. As far as I know, I don't think we have any breast cancer screening programs in Eritrea, but as my colleague said before, yeah, there are some certain screening done in the private hospitals, but it's not that much.
Okay, it will be interesting to talk more about that during the discussion.
Okay, my name is Dismas Damian. I'm a global health specialist from Tanzania. So we have a general breast cancer screening. It's not a sort of a program, an independent program, but actually breast cancer is among the leading of the gynecological cancer, in addition to the cervical cancer. So particularly what has happened is that breast screening has been integrated in many of the sexual reproductive health services, like family planning. So there isn't a component of breast cancer screening. There also have been campaigns with the different organizations advocating for self-screening of breast cancer issues for women in the country.
Okay. Okay. So I think that's a very interesting point, and the first question is also related to that point. So how is the breast cancer screening, and now everyone can just answer if they have something to say, how is breast cancer screening organized in your country? So which services, are there guidelines? Feel free to tell us about it.
In the past in Egypt we have mammography vans which moves around districts to screen women above 45 years old. But nowadays we have, from the last year, we have a very huge public health campaign from the Egyptian president towards screening all women above 18 years old. It's very good, well organized, and screen about many millions women for breast cancer. As I mentioned in the beginning, breast cancer is increasing, and the most critical point is awareness about this, because many cases are diagnosed in late stages, even if the patient is very young, before 30s. So screening programs are very important in Egypt, and I think it's improving from the past, because the van is not available for every woman, but if there is fixed clinics only for screening of breast cancer, it will be very nice.
Are there in other countries similar programs like in Egypt, or completely different programs?
When it comes to our country, Sri Lanka, so we have a policy where when the woman is when she is 35 years, usually they have to go for the primary healthcare setting in their own community to detect for breast cancer and cervical cancer. So usually that is carried out in primary healthcare setting in our country. And when it comes to the health sector, so we see there's a policy, and it's like policies include different guidelines. So to some extent, like the policies well implemented, and even we can see a good improvement in each primary healthcare setting in each community.
Okay. How about Tajikistan?
Yeah, in Tajikistan we also now we have national policies and WHO policies about the breast cancer screening. So it's getting better day by day, and for example, when women come for antenatal care, postnatal care, and the reproductive health centers, so the healthcare providers, they conduct the awareness, health education to those mothers, how to do their self breast examinations, and so that as Mary mentioned about the Egypt, like late stage presentation to the clinic. So we have the same problem, but it's like mostly in the rural place. So the problem, like in the rural place, they don't have an access like to the health facilities. So the problem is mostly there. When they come for the examination, it's already the late stage. So then the healthcare providers, as I mentioned earlier, that they conduct the campaigns and breast examinations, all these things, and those who are suspected to have breast cancer, they'll then refer to the nearest health facilities for further examination and treatment.
Are there other people that recognize that from their country, that maybe women come at a late stage of the cancer?
I think that's a common, because most of the breast cancer are silent. So people just notice that they have breast cancer when signs are, when it's always a late stage. So basically, I would say we had this medical women association that actually was I would say the first initiative to talk about breast cancer in our country. So like they had an ongoing campaign that managed to reach the information to the large population, informing them that you can detect this early before you present with signs. And then that's where it was incorporated in many of the services that, and an initial focus was to breast screen any woman who comes in for health services. But then I think the focus shifted to why don't we teach them to do them even at home and not wait for until they come to the health facilities. So when a woman comes into antenatal care, she's even taught how to do the breast screening by herself. And when you are, so like the family planning programs, it's an essential component that you make sure you train a woman to be able to screen her breast so that they can detect these early changes of the breast before it even changes to a breast. But I still recognize the chances. So even if it detects the changes or whatever the mass, he has to go to the facility. So the distance issue still remains the same. The cost, he has to transfer, he has to do investigation to make sure if that's still a barrier.
So I think we have discussed a lot of different aspects of breast cancer screening. It differs, it's depending on the country, different ages at the screening starts, also different access. We have discussed some challenges in your countries. I think it's very, we have a lot of information thanks to your answers. Is there someone that has something to add, something that's really important and that we have not discussed, for example?
Well, I would add to my country's case. Of course, like I said before, we don't have programs in breast cancer screening, and the awareness is not even up to date. So women are not up to date, and they know little about self-screening and all. I have heard once or twice a gynecologist presenting in a national television telling or teaching women and young girls how to do or to perform the self-examination, but still this program is not going well. So this kind of challenges are there, and the experts on this specific training is also lagging behind. So kind of we have a lot of challenges, and like they said, our colleagues said, or this must said, most of the time, a complicated case of breast cancer arriving to the hospital at the late stage, in which the doctors or the health system could not do nothing. So,
yeah. So if I can conclude, there are big differences between the countries. It's still a very global health problem. The access, the quality of breast cancer screening. So it's something we should all think about together for the future. It's becoming a real emergency. The amount of women with breast cancer that die from breast cancer that come in late stages. Yeah, we will use this information to find a solution altogether. Yeah, thank you very much for. Is there someone else that has something to add or a question for now?
No.
Okay, then thank you very much for your participation. As I said, it was a very successful discussion. I would like to remind you that all the information is anonymous and that you are also asked to not share the information with others. If there's something, if there's something you want to express outside of this session, feel free to come and see me or my colleague. And thank you very much. Have a good day.
Thank you. Thank you. Thank you.